Hello, good evening, and welcome to this week's edition of Economics Unbound. And tonight, well, we'll be asking a very important question. What would a third wave mean for the South African economy? Now, since the first case was recorded in March 2020, South Africa has experienced two waves of COVID-19 infections, and the second, well, that proved to be deadlier than the first. Now, experts are warning that a third could be deadlier, a deadlier wave, and that is approaching. In fact, some provinces are already suggesting that they're in it already. A report released by the South African Medical Research Council last month showed that the second wave of COVID has by far obscured the first, with almost 14,000 excess deaths in the first week of 2021 alone, and more than 16,000 in the second week. Now, this is more than double the highest number of excess natural deaths that suffered at the end of July, and that was the previous peak of the pandemic.
Good evening, Peter, and dear viewer. Well, we also see the lessons ahead of the third wave. It is likely to be bigger than the first waves if the evidence from other countries is anything to go by. What is important is how we prepare our hospital capacities and how we try to flatten the curve. I think this will be the most important intervention that we'll have to make to better prepare.
Health Minister Dr. Zweli Mkhize said that South Africa is in its third wave of COVID-19 infections, but experts are warning that the local economy cannot afford another strict lockdown. He also said that he warned provinces that COVID-19 cases are rapidly rising in South Africa. The latest warning from Mkhize came shortly after he warned of an increase in cases in the Free State, Gauteng, Northern Cape, as well as the Northwest province.
Numerous districts in these provinces have been flagged by the National Institute for Communicable Diseases and have been placed under observation due to an appreciable rise in the 14-day average percent change. Experts say the rise in cases may result in additional lockdown measures, like restrictions on large gatherings. Winter periods made it difficult to contain the virus, which means that, even with restrictions in place, it would be challenging to avoid another wave. Many business leaders are warning against strict lockdown measures, which will have a negative impact on the economy. Many sectors in the economy, including the alcohol and restaurant industries, have been severely damaged by previous lockdowns.
According to the Bureau for Economic Research, the hikes in electricity and fuel prices, as well as the end of the government's temporary COVID-19 relief measures, were also expected to hit consumers' disposable income in the second quarter. Well, South Africa, the most industrialized country on the continent, saw a first wave of coronavirus infections when it was already in recession. It had to impose two hard lockdowns to curb the spread of infections, setting the economy back by 13 years, it's believed, pushing millions more into unemployment at a time when almost a third of the population was already jobless.
The finance minister said the country's flouting exchange rate, low and stable inflation, and a well-regulated financial market were positive factors that could lend support in the event of another crisis. He also says there is also a risk that investors will start to distinguish between those emerging markets that are rolling out mass inoculation programs and those that are lagging on this front, and at the same time lack fiscal resources to support economies through further lockdowns.
Well, to help us unpack some of these issues, we're now joined by Professor Yanni Rousseau from the Wits Business School. Professor Rousseau, always good to talk to you. Thanks so much indeed for joining us.
Good evening, Peter, and good evening to the viewers.
All right, so we're not quite sure what a third wave is going to look like for South Africa. We've seen it in other parts of the world, and it really hasn't been pretty there. So that may be a worst-case scenario. Either way, a third wave is problematic for us. How do you think it'll play out if we keep the shops open, keep businesses open?
Well, Peter, unfortunately, this third wave comes as winter comes in South Africa, and we know by now that the COVID-19 infection, the virus, does not like heat. So it comes at the worst possible time for South Africa, moving into winter. My view is that we need to manage COVID lockdowns at a provincial level at the moment rather than at the national level. We need action in those provinces being hit hard by COVID at any given point in time rather than to try and manage this from a central level for all areas in the country. Where we see provinces with sharp increases in lockdowns, in COVID 19 infections, we need a different degree of lockdown compared to those provinces where we do not see an increase in COVID 19 infections.
But I suppose the only way to make that work is almost to say you've got to stop inter-provincial travel, because a lot of people move between provinces and it only takes a handful, one bus, to move the pandemic from one place to another.
Indeed, if you have provinces with large spikes in infection, you will have to stop movement out of those provinces. So you will have sort of, for lack of a better word, to have quarantine in respect of that province. You will remember when we had the first wave of COVID-19 infections, all interprovincial travel was prohibited except with special permits. And with a provincial approach to a COVID-19 third wave, you will have to have a similar approach with limitations on interprovincial travel.
What effect will that have on the economy? Gauteng is the biggest economy on the continent all by itself. If you shut down Gauteng, that's pretty much, and then Western Cape is also looking like it'll do a third wave as well. So if you shut down Gauteng and Western Cape, haven't you effectively shut down the South African economy anyway?
Well, Gauteng is about a third of our economy, the Western Cape about 15% of our economy. So if you talk about those two, you are close to half of our economy, which is less severe than shutting down the whole economy, as we did in the first wave about a year ago in 2020. So it's better to have a shutdown for half the economy than to have a shutdown for the whole economy.
All right, so it's unlikely that we'll see the kind of shutdowns that we've seen before. We are in an election year. People are already fatigued, and we're seeing other countries being vaccinated and our vaccination programs underway. So it's unlikely that we'll probably see a lockdown, but we will be affected one way or another. Let's assume we don't shut down and that we perhaps do curfews rather. Do you see the economy being affected still, or what scenario might play out?
Well, we will have better economic performance this year than last year. Last year, the economy shrunk by about 7%. So we will see better economic activity this year, if for no other reason, because people and businesses adapted to a COVID lockdown. However, in terms of vaccination, it's very clear now that the government cannot handle it. The government doesn't have the capacity to handle the inoculations. So we need the government to get the private sector into an inoculation program to run it out much faster than what the government is trying to do it. There's no reason why the government cannot use the private sector, like private medical facilities, to help with the inoculation program.
What's your biggest fear for the coming months, particularly this winter cycle?
My biggest fear, Peter, is that people will go hungry, that people will literally have nothing to eat. I mean, please, we are all South Africans in this country, and we all need to take care of one another. And I have a big fear that people will not have enough to eat in these winter months because they've lost their jobs on the one hand, and on the other hand, if we go into stricter lockdowns, more people may lose their jobs and people might not be able to eat. I'm really concerned about that. So that is why I feel a provincial approach can deal with this problem much more effectively. And secondly, if we have a much faster inoculation program with the private sector playing a role, it will be easier to get South Africa through this. Unfortunately, we have a government in South Africa that has complete distrust in the private sector.
Do you think that government will be forced to relook these relief subsidies that had been initiated and ran for a while? But, you know, we've only got a fiscus that can only take so much. And it seems that we're right at the end of that. But if a third wave does hit and you're talking about people starving, might government be forced to relook their social spending?
Well, the government has run out of money. I've warned about the fiscal cliff many times. You and I have discussed the fiscal cliff on many times before, on many occasions before. But the government will have to reprioritize spending. For instance, given the current state of the South African economy, there is no justification to give money to SAA. 10.5 billion rands giving to SAA could have gone a long way to make sure that people do not go hungry in this country. So it's necessary for the government to look urgently at its spending priorities, specifically in respect of state-owned enterprises. There's no justification to keep state-owned enterprises like Denel, like South African Airways, like Alexcor going with taxpayers' money. Rather give that money to people really in need.
That's a lot of people that are employed by those state-owned enterprises. Are we saying that we just farm them out and say, good luck, thanks for your service?
Well, all I'm saying is, if they cannot run those businesses in such a way that they can keep their workers employed, their employees employed, we have to take tough decisions, because we are taking decisions here in the interest of all South Africans, not only in the interest of those people working at failed state-owned enterprises. So we are paying a high price now to keep state-owned enterprises that have no economic justification to continue their existence going. So it's a time for tough choices in South Africa.
The policymakers probably have factored in a third wave. I wonder if they have. And I just, from what you've heard and the kind of rhetoric that's been coming out of government, do you think that we are prepared for a third wave and that post-recovery, let's say we get the vaccination done in the next year and a bit, that we're going to be set up going forward with the actions that we're taking now?
From government's perspective, I don't think we are prepared for a third wave. The way to be prepared for a third wave is much faster rollout of vaccinations. The government, as I've said, should partner with the private sector to achieve that. Incidentally, in my view, the private sector is much better prepared for a third wave, has adapted to change circumstances over the last year. For instance, a year ago, I would have been in studio with you tonight. In the last year, we figured out how to do this through electronic means without a hiccup. So the private sector adapted to COVID-19 in a much more agile way than the government.
Professor Jannie Rousseau, always a pleasure talking to you. Thank you so much indeed for joining us. Thank you. All right, that's Professor Jannie Rousseau speaking to us from home, and he's of course at the Wits Business School. We're going to take a break, and when we come back, we'll continue exploring what a third wave might mean for South Africa's economy and ultimately you and I. Stay with us.
Over the last few months, a decline of new COVID-19 cases and the beginning of vaccination campaigns across several countries fueled the world with optimism about a durable solution for the pandemic. However, a third wave of new COVID-19 cases is emerging globally, tempering the more optimistic views about a quick recovery from the pandemic. As the third wave of new COVID-19 cases accelerates, several countries are moving towards more aggressive mitigation strategies. Those include the reimposition of hard social distancing measures such as quarantines, curfews and lockdowns. The objective is to lengthen the time through which the virus spreads and to flatten the curve of infections before hospitals get overloaded by a bigger surge of severe cases. The aim is to save lives, increase recovery rates and avoid unintended consequences associated with strained healthcare systems. This third wave of hard social distancing measures will come with costs to the global economy, potentially slowing more or even derailing the economic stabilization process that started in the quarter of 2020. High-frequency mobility indicates a proxy for overall economic activity, shows that economic activity comes to a halt, which each time rather with restrictions and lockdowns. The first and the second waves of restrictions led to economic contractions, which suggests that ongoing third wave will have a similar impact. Three main causes of the new wave of COVID-19 cases that are currently preventing a normalization of economic activity. Firstly, as COVID-19 spreads and mutates, a new, more infectious strains of the virus are created. At least three major new strains of the virus has been identified, including the one circulating massively in the UK, Brazil and South Africa. More infectious strains are more challenging to be contained. Secondly, compliance with social distancing measures became more relaxed due to a combination of fatigue and optimism with the approval of vaccines. The approval of several effective vaccines created a perception of safety among part of the non-immunized population, which affected their behavior and increased with their exposure to the virus. Constant flare-ups of new cases created the need for tighter social distancing measures and go-stop and economic patterns that are negative for investments and economic stability. Despite vaccine optimism, a third wave of COVID-19 cases proves that the pandemic is still expected to cause economic turbulence in 2021. We expect a more meaningful recovery to start only in the second half of 2021, when mass vaccination is likely to be more advanced in the larger economies and a more permanent economic open-up can start globally. Well, for more insights with my colleague, Peter Ndoro.
Prudence, thanks very, very much indeed for that. Okay, let's carry on with this conversation. Third wave is upon us. Some provinces feeling it already. And so the question now becomes, what might that mean for the economy and for you and I in general? And to help us look at this a little bit more, we're now joined by Dr. Ntabiseng Moleko, who's a development economist at the Stellenbosch Business School. Thanks so much for joining us. Always good to talk to you. I'm always quite refreshed with your opinions about what needs to be done. So,
thank you, Peter. Very good evening to you, listeners.
All right, so here we are. We've done two waves. We've started to open up the economy more and more. People are going back to their workplaces. We're experiencing traffic in the morning for the first time. And now this third wave is on the horizon. And questions now must be how we tackle this. What's your gut feeling of how we should approach this?
Peter, this is a very complex and difficult issue to deal with. I think the primary issue is that we don't want loss of life. I think fundamentally we all agree to that. But also we don't want loss of life due to poverty. So I think that having looked at the effects of the shock from 2021, from 2020 rather, into the year, how we have seen the cost to the economy, but also to the lives of South Africans, we've got to take very much into consideration the long-term effect of this also on the livelihoods of our people. I think, number one, we've seen that from the aspect of job losses, we haven't recovered. We know in the Q2 last year, we lost 2.2 million jobs immediately due to lockdown regulations. And the recovery meant that we still net had 1.4 million losses overall. So we have not recovered. And on the back of that, we already had more than 11.8 million South Africans sitting in the unemployment proportion, that 42.6% of our people that are not working. So I think number one is that the livelihoods of our people have worsened from an economic livelihood perspective, from an ability to access incomes. We've seen the shutting down of many businesses, primarily by virtue of the decline in economic output. So that 51% contraction we saw in that first quarter because of the lockdown and the stringent regulations led to that annual decline of a negative 7.2% in the year. So we saw a decline in economic activity. If you look, I mean, I was in Cape Town, at the center of Cape Town, and I saw walking around some of the streets when you go from the parking to the office, businesses have shut down, clothing shops, businesses that sell food. SMMEs have had to close down because they couldn't sustain economic activity, pay wages, and as a result, you saw an average income drop of about 30%. So these are serious consequences that have come with the effect of the pandemic. So I think that the economic shock, we've got to look at how do we regulate social distancing, make sure that people comply, but we don't devastatingly impact negatively the health and the livelihoods of the health of the people. So we've got to balance very carefully this time, and probably our measures need to be very measured to try and lessen the adverse effect and the shock on the economy.
I would have loved to have said, can we learn lessons from other parts of the world? But of course, these countries have trillions of dollars and euros to back them up that we just don't have. So I'm fearing that this third wave may be worse than we're hoping it might be, and that actually there's not going to be much we can do to avert job losses, even if we lock down, even if we do this piecemeal or carefully, as you're suggesting. It's almost an inevitability that there will be losses. I guess what we're trying to do is to minimize them.
We can't accept that, Peter. We can't accept that there's nothing around or other ways around it. I think that we can definitely do a lot to try and mitigate the supply shock and the demand shocks, particularly on the contraction of subsectors. I think what we don't look at sufficiently is what the real effect of having up to 90% contraction in a subsector means. This simply means that suppliers cannot operate. This simply means that family businesses are going to close down. This means that the single-headed households, particularly those who have single-headed households, one individual working, primarily the caregiver or the mother in that family. In South Africa, we know that we have a large proponent of our families that are single-headed households who may lose their jobs. It simply means that the worsening situation of the social structure of the social fiscus having to aid more with a depleting tax revenue. Remember, the tax revenue declined by 213 billion in this last financial year. Even though we didn't see that estimated, I think it was 304 billion that we had purported in the year, 213 billion offset is still quite significant. And that budget deficit that we're struggling to see come back to the fore with increased output is not going to regenerate itself if industry is not operating. So I think that the measures, the stringent measures, have to look at how do we lessen the contraction of sectors. We can do something about it by making sure that there is an adherence to social distancing, there is an adherence to making sure that people wear masks. Perhaps the laissez-faire approach, where people are not taking as seriously some of these measures as necessary, should be improved. But I think that insofar as making sure that we try and make sure household demand, SMME demand, and we don't reduce significantly economic activity. Remember, Where the source of COVID started, economic activity quickly bolstered up. And it wasn't on the back of money. It was on the back of prevention. It was on the back of some of the measures that they put in place. And the Chinese in the second and the third quarter saw manufacturing boosting itself, literally employment being generated. And yet that is where it started. So I think it's important for us to see that there are other parts of the world that were able to recover, but making sure that people were actually making sure that the reforms were put in place in terms of from a social behavior perspective.
All right, so what kind of things can we do immediately, ahead of the third wave, so that we can get through it and will set us up for afterwards when hopefully we're starting to breathe again, we're being vaccinated, and we're starting to see light at the end of the tunnel. Give me 2 or 3 things that you think that can be levers for big change.
Let's agree that we're not going to do level 5 lockdown.
Right.
We're not going to do level 4 lockdown.
Right.
That's the first thing, in order to not have this effect, right? So we agree on that. Then the second thing is, let's agree as people to be responsible. What do I mean by that? Let's take the measures seriously. If we're being told as households, as communities, to not have, for an example, late night evenings where people, you can see clearly with social media and the videos that go and circulate that many of the SMMEs that are in the, let's say, the hotel business or within the entertainment sector are not complying. Those businesses should be super spreader events, so to speak, should be mitigated, and the community should take a harder measure on those type of events, because it's one event that can spread rather than looking at I'd say macro events that don't necessarily have non-compliances. That one event that actually spreads, and we saw that in the Eastern Cape, where I think it was a funeral that caused the entire spread across the province. So those super spreader events need to be mitigated, and there should be harsher measures for those who don't comply, particularly business owners that enable that type of a behavior. I think that's the second thing. So it will help in quelling the quickening of the spread, but also you'd find that some of these issues are raised and increased by simply 1 or 2 super spreader events that quicken the likelihood of that spread, rather than if all businesses in an industry or in a community are actually complying and you don't see a massive effect of that. I think thirdly, let's be hopeful. Let's be hopeful. Am I allowed to say that?
Yes.
Let's be hopeful. We've seen a 95% recovery rate. There's nothing like this before. We've seen I'm not a scientist or a health practitioner in any regard. I think there's experts who know much more about this than me. But let's be hopeful. People are recovering, 95% recovery rate. And so we cannot be doom and gloom. You will recover. You will see yourself overcoming this this pandemic as a nation, as a people. So it doesn't mean doom and gloom. I think that focus on positive things, look at things that are hopeful, that brighten up your day, read the word, do things that brighten you up and give you a hopeful future and make you see beyond the present. And I think that we will overcome. We've overcome the first, the second. We will overcome this third wave. This is what I believe.
You know what? I'm feeling that hope straight from your lips into my heart. So thank you so much, Dr. Nthabiseng. I look forward to chatting to you again soon. Thanks so much for joining us.
Thanks for having me.
All right, that's Dr. Nthabiseng Maleko saying we need to have hope, and we should not forget, actually, as she was saying, that the recovery rate for COVID-19 is as high as 95%. So a lot of us will get through it. So it's not something for you to fear. Be careful, obviously, and be cautious, obviously, but we don't need to fear it, and we will get through it. We just need to brace ourselves and be positive. So thanks so much indeed to Dr. Maleko there. All right, let's move on. And you know what? There's debates around the economic impact of COVID-19, the pandemic, and this tends to revolve around struggles of the corporate organizations, agricultural companies, especially small ventures who've also been severely affected. And we've just heard that actually from Nthabiseng. Well, an online Emerging Farmers Summit revealed that despite overall favorable agriculture and weather conditions, including a good rainfall of 87% of small farmers in South Africa did not manage to recover from last year's hard lockdown. Beyond COVID, co-founder Etienne van Wyk spoke more on this.
When we did our first set of results around September 2020, we had a situation that 20% of large businesses, as well as 20% of SMMEs, were operating under business as usual. Both of them had suffered an equal demise in their business. Subsequent to that, their fortunes have, however, differed dramatically. 44% of large corporates are operating on a business as usual basis, while only 17% of SMMEs, are still operating at the level that they were before the lockdown. In agriculture, that's been worse, with only 13% of the SMMEs returning to business as usual levels, while the large corporates were operating at 63% had returned to their business as usual levels prior to the COVID lockdowns. So the difference in the fortunes of the large businesses and the SMME sector has been vast. Now, there has been some remarkable efforts during this period, people that have taken the initiative, specifically, large corporates that had partnered with micro farmers in order to operate as a unit, and in the process give those small farmers access to the markets and access to the supply chains, which is what really crippled the small farmers. If you want to prevent this going forward in the future, and if you want to recover from what has happened, you've got to understand why the small operators were so severely damaged. And it is about their access to markets. You can just imagine, if you're dependent on selling your wares to a school, a local non-profit, to hawkers, there might be spaza shops and other micro retailers that might have needed to close during the lockdowns, and you weren't able to sell to Pick n Pay or Woolworths, you were devastated.
So that's the agricultural sector. Now, the liquor traders, well, they say that they'll defy any unconstitutional restrictions on alcohol as a preventative measure against the spread of COVID-19 infections and the third wave. This is after growing concerns that the alcohol ban may be on the rise for government to try and prevent the country going into a severe third wave. Well, the convener of the National Liquor Trader Council, Lakin Timane, spoke more on this issue.
A problem with the government trampling on our constitutional rights as enshrined by Section 22, which protects our right to trade in any form of trade that we so choose. We chose alcohol, and that should be respected. We feel aggrieved by government's continued insistence on making decisions on behalf of liquor traders without liquor traders. We feel that it's about time the government finally coming to its senses and talk to us about any issue that relates to liquor traders and the sector as a whole. We feel that it's about time that we're able to sit with government and look at ways and means in which we can support each other in terms of livelihoods and lives, as we've been doing all along. But government really needs to come to the party. We've been reaching out to various ministers with no success. I think for us, the only option left now is really, to rely on the conscience of the president to really do the right thing and allow the liquor traders to be able to operate beyond the third wave, because we have proven over time that, we are a partner to government. We haven't had any issues that could be linked to the alcohol industry as being a super spreader in the past 3 months. So the least that government can do is really to talk to us to find a long-term solution that is going to ensure that as a country we fight COVID-19 pandemic together. Ours is really to give caution to the wind to say that we will not allow such conversations to take hold. We are going to challenge any talk of a ban on a sector that has suffered almost 20 weeks of non-trading. So we are taking a proactive stance as a sector to say that we will not entertain an issue of a ban. If it's a restriction, it's something that will be done only with our consent. We need government to really level with us on this issue.
All right, so tough talk there from the liquor industry. We heard about the plight of the agricultural sector beforehand. But not everybody is pessimistic about what a third wave might look like. SME On Point shined the spotlight on a dairy processing plant whose founder is optimistic despite the looming threat of this third wave for COVID-19. The story of Southwestern Dairy is edited by Manqoba Nkosi. Let's listen to this interesting story.
Nkosana Mtimkulu says milk has always been his favorite drink for 28 years of his life. Today, Mthimkhulu is a milk processor and founder of Southwestern Dairy, together with his father.
Prior to that, I was farming, dairy farming, from 2010 to about 2014. And then from 2014 to about 2017, we decided, let's relook the business and see how we can get into processing instead of just farming. So this is how the dream of Southwestern Dairy started. So the dream came from my father. I just ran with it. And here we are today. We still have a long way to go. We basically want to be one of the top 5 dairy companies in the country.
Southwestern Dairy processes pasteurized milk, juice and sour milk. Mthimkhulu says as a business, they want to revitalize the milk industry, especially since many small players in the industry have closed their doors.
And we want to allow for the small and emerging farmer, as well as the medium-sized farmer, to have a stake in the milk economy. So we will buy from them, and they will do what they love, which is dairy farming. And we will take their product, we will process it, package it, and send it to market. And in that way, we're creating lots of sustainable jobs, we're growing the economy, and we're allowing for emerging dairy farmers to come into the business.
The company employs 7 permanent staff with the aim of hiring 500 more workers in the next 5 years. Mthimkhulu says lessons were learned during the first wave of the pandemic, and with the third wave looming, he hopes government will prioritize small business support.
Agro-processing is the buzzword right now in South Africa. However, we cannot have more agro-processors unless we're focusing on the farmer. So where the produce comes from is the most important. So we need to have more farmers, we need to have more producers, and then only then can agro-processing survive. So we need to look at the entire value chain. So the farmer, the producer, needs to be secured, needs to be taken care of, needs to be subsidized, needs to be supported so that they can thrive and produce good quality products and produce which will come to the processors like us, and we will add value to that and send it to the market.
With increasing opportunities in the agro-processing industry, Mthimkhulu says more government support is what he needs at this point in order to thrive.
An environment that's conducive for us to thrive. I'm talking about, as a black processor, let's talk about procurement. We know about the 30% thing about black suppliers, but it hasn't even, I don't even think 30% of government's procurement goes to small, medium-sized businesses. So things like that need to actually happen. They mustn't just happen on paper, but they must happen in reality. Because once that happens, then when we have small businesses that's thriving, the country will thrive.
Diabo Seto, SABC News, Johannesburg.
Welcome back. You're watching Economics Unbound, and this evening we're trying to figure out what we might be able to do to survive a third wave, which looks very likely. In fact, some provinces have already started to see an increase in numbers as we speak. So what does that mean for the economy? What does it mean for you and I? Well, we've been speaking to a number of economists, and now we talk to a businessman. And we're joined by Kuseni Dlamini, who's the chairman of the JSE-listed Aspen Pharmacare Holdings Limited. And that's the leading pharmaceutical manufacturer in the Southern Hemisphere, with operations in over 50 countries. Kuseni, always good to talk to you. Thanks so much indeed for joining us.
It's a great pleasure indeed, Peter. It's wonderful to be part of your program. Thanks for having me.
All right. You wrote an interesting article recently looking at this whole third wave story. And I was just wondering, you know, when people put pen to paper, something has provoked them, something has irked them. And what was going through your mind when you thought, I have to express my thoughts here? What did you see?
It's really the unacceptable and, dare I say, shameful state of affairs in how the international community is handling the COVID-19 pandemic. More specifically, the lack of enlightened leadership around the need for fair and equitable access to vaccines. We've seen the scourge of vaccine nationalism and vaccine apartheid, which I see as the twin evils confronting the world now, just rearing its ugly head around the world. And we're seeing the world really being divided into two camps. It's a tale of two worlds. On the one hand, we have a world of vaccine haves. On the other hand, we've got a world of vaccine have-nots. The vaccine haves are largely the rich, industrialized countries in the Northern Hemisphere. And the vaccine have-nots are largely the developing countries in the Southern Hemisphere, which have got less resources and therefore limited access to vaccines. And what we need in times like these, Peter, you remember during the 2008 global financial crisis, we saw leaders rallying around, coming out with a coordinated response on a global scale to the financial crisis. But during this pandemic, the lack of global coordination and cooperation and leadership has been conspicuous, and that is shameful. And we've seen the G20 meeting as well recently. We're all having our hopes being raised that they will discuss and deal with the issue of waiving patent rights for COVID-19 vaccines so that developing countries can have the opportunity to manufacture vaccines for their own people in their own regions and enable access. But we're seeing these countries really digging in their heels, and they're refusing to show a sense of global social solidarity, which is required. So that's really what preoccupied me. And I think there is nothing short of really realizing the simple fact that no continent will be safe until all continents are safe from COVID. No country will be safe until all countries are safe. And no person will be safe until all people are safe. We are in this together. It is not an optional extra or a nice to do
So, Kuseni,
to work together. It's a must.
This is a great ideal, and one that we really should be looking at in a multilateral world. However, if you're a head of state of a country, your citizens are looking to you to make sure that your citizens are taken care of first. So there is a natural instinct, I guess, for a lot of these developed nations to say, we've got to make sure that every single person in America has a vaccine, every single person in the United Kingdom has a vaccine. When we have extra, that's when we'll share. And I think it looks like that's the approach that they've taken. Yes, it should have been more, but with the pressure from citizens, can you imagine you're in a queue and you're hearing that your country is exporting vaccines and you're waiting to be vaccinated?
You're absolutely right, Peter. I think that the argument you're making is very sensible indeed. But I'll turn around and say that actually it is actually foolish to think that you can just isolate yourself and your people from the rest of the world and vaccinate them and leave the rest of the world infected, and you think that you would be an island that is free from this vaccine. We live in a globalized and still globalizing world, and it is inevitable that there is no way in which one country can be safe until others are safe. So the my country and my people first approach, which we're seeing from some countries and some leaders, is really an unhelpful and, dare I say, a very foolish approach, because it's just going to prolong the extent to which we can have a global recovery. And at a regional level in Africa, there is no country in Africa that can be safe from COVID until all African countries are safe. So, in the context of SADC, we can't be safe until the whole of SADC is safe as well.
So, Dr. Kuseni, my question to you then is, here you are, chairman of a major pharmaceutical company in the world. Why on earth have you not developed the vaccine here in South Africa? I was pleasantly surprised when I heard that Dr. Tatenda Chopera, a Zimbabwean, was on the team that developed the Pfizer vaccine. So we have the minds on the continent, we have the brains on the continent. They're sadly in the diaspora and all sorts of places except here. And you, the chairperson of a pharmaceutical organization, surely we should be learning from these experiences, like we did with Ebola, that we have to look after ourselves, develop these vaccines, because we cannot be waiting for the altruism of the international community.
Absolutely, yes, spot on. But I'm pleased to say that as Aspen, we are actively involved in finding global solutions to this global pandemic. We have a factory in Gqeberha where we are manufacturing the Johnson & Johnson vaccine, and we're one of a few manufacturing plants in the world that have been chosen by Johnson & Johnson to do that. But to the point that you're making, I think what the bigger picture here and the bigger learning point from COVID is we've seen global supply chains being disrupted, and South Africa and Africa and developing countries have got to develop their own capabilities and resilience to be able to manufacture vaccines, manufacture PPE, medical products, equipment, and I say across other sectors as well, ICT, renewable energy, the capital goods sector. We need to really rethink our industrial policies, build centers of excellence across all strategic industries so that we can be global players and global leaders that do not just wait to depend on other countries. We've got what it takes. You mentioned one example, even in the other vaccines that have been developed. If you really look at the scientific teams that have been actively involved there, you'll find that there will be Africans that have been part of that, there will be South Africans that have been part of that. There are other members, citizens of emerging markets. Actually, it's not just people from the first world countries that have the intellectual know-how. With globalization, talent moves across borders and across continents. So we need to hold on to our top scientists, our top minds, give them the right support from a research and development point of view, and encourage them to stay here. Even those that go, encourage them to stay in contact and share the knowledge that they have and bring it back home.
All right. As a businessman, what are the strategic things that we need to do to ride this third wave and set ourselves up for the period afterwards?
It's just, I've got a 5-point plan in terms of that, or 5 points really, not really a plan, 5 points that I think we need to consider in terms of dealing with the third wave. The first one is really to learn from our own experiences of dealing with the first and second waves. We saw the government really doing an excellent job in terms of communicating with the public, reaching out and engaging every citizen to be part of this response. And we saw the non-pharmaceutical interventions that were promoted, being adopted by citizens, by people across the country. Yesterday I was in Limpopo. It was just encouraging to see everyone wearing a mask, everyone social distancing. So I think we need to learn from the experiences of the first and second wave, how we dealt with it. There are things that worked and there are things that didn't work so well. So let's learn from the things that worked. And then secondly, we need to learn from the experiences of other countries in terms of how they've responded. The countries that come to mind is New Zealand, it's Singapore, and it's China. They've done an excellent job in terms of containing the spread of the pandemic in their own countries. The third point is really collaboration and partnerships across all sectors. We are in this together, and we need to be able to build a coalition of the willing and let everybody play their part in this. And then number 4, it's really sharing resources, capabilities, and expertise. We saw the setting up of the Social Solidarity Fund, in South Africa, which was a great initiative. Ordinary South Africans
we're running out of time,
donated.
so very quickly, what's the 5th one?
Oh, the 5th one is vaccination, which let me jump into that.
Yeah.
That's the most important one of all the points. We need to expedite the vaccination program that we have. We are falling behind. We're one of the least vaccinated countries in the world. We are below the average vaccination rate in Africa, which is just above 1%. We're still under 1%. So we really need to redouble our efforts in terms of rolling out our vaccination program. There is no escaping that challenge and that reality.
All right. My dear brother, always good to talk to you. Thank you so much indeed. And keep up the good work at Aspen. Please develop more drugs and vaccines and that we can sell to the rest of the world. Thanks so much indeed for joining us.
Thanks, Peter. Keep up the great work as well. Great talking to you.
Thank you.
Bye-bye.
That's Kuseni Dlamini having the final word on the show, because that's where we come to the end of tonight's edition. Thanks so much indeed for joining us, and join us again next week at the same time for more of the same. In the meantime, please be careful out there. COVID is real, so follow those protocols and be safe. Take care, everyone. Bye-bye.